Next topic is that rheumatoid arthritis. It is a systemic disease and it is chronic inflammatory disease. Mainly it affects the joints but may also affect the tissues or other organs. Then the etiological factors. Three etiological factors are responsible for this disease. First is the genetic. It is a major factor that involves in this disease. Uh, Two types of the gene. First is the HLA type gene and another is non-HLA type gene. In the HLA type gene, the HLA-DRB1 locus is involved, and in the non-HLA gene, there is polymorphism of the PTPN22 genes and which code for the tyrosine kinase enzyme. Next is environmental or the arthritogenic cause. There is have the smoking and microbial agents like the virus, mycobacteria and mycoplasma can responsible for this disease and which may initiate the disease. Then autoimmunity, that autoimmune reactions with the T cells causes the initial inflammatory synovitis and then there is chronic destructive disease. Next is the pathogenesis of the disease. First, there is breakdown of the immunological self-tolerance, and there is cytokine mediated inflammatory response is there, which causes the activation of the CD4 T cell and also activation of the B lymphocytes. Then CD4 T cell will now release the cytokines. Th1 will release the gamma interferon and the TNF. Th17 will release the interleukin 17 and interleukin 8 and the 6 also release. And activation of the B lymphocytes, then they transfer into the plasma cell and produces the autoantibody. Both of them now causes the recruitment of the macrophage and the inflammatory cells. The product of these cells now causes the tissue injury. And there is activation of the resident synovial cells called the synoviocytes. They will release the proteolytic enzymes, that is collagenase, stromolysin and the elastase. With the help of the immune complex, they will causes destructions, and with the TNF they will destroy the bone and they also destroy the articular cartilage, ligament and the tendons. Consequence is that in the synoviocytes there is the edema and the hyperplasia, and in the synovium there is the inflammatory infiltration will occur, and then there is pannus formation which will adhere and grows over the articular surfaces, and destructions of the cartilage will occur and there is erosion of the adjacent subchondral bone. Now see, this is the healthy bone. This is the synovial cells. Here is the cartilage and here is the bone. But in the rheumatoid arthritis, their bone matrix destructions will be occur. Here from the vessels, macrophage, neutrophil, B cell, T cells will enter into the joint space, and so joint diffusion will occur and it will causes the synovial hyperplasia, and also there is pannus formation. The inflammatory cells aggregate and pannus formation will occur which will now destroy the articular cartilages. Next is the morphology, how the joint, synovium, skin and the blood vessels are affected. So joint, in the most severe cases, the joints are involved symmetrically and bilaterally. That is most commonly involved is the proximal interphalangeal joints, metacarpophalangeal joints, elbow joint, ankle, knee and the spine are involved. Joint lesion is that there is a chronic non-suppurative proliferative polyarthritis is there. There is inflammatory synovitis will occur which progresses to destroy the cartilage, and there is ankylosis of the joint will occur. In the synovium, grossly we can see in the synoviocytes there is the edema, thickening, hyperplasia and the hyperplasia will occur. In the synovium, the smooth surface now becomes delicate, bulbous and papillary. Microscopically we seen that in the synovium there is synovial hyperplasia, that is synoviocytes from the 2 to 3 layers now become the 6 to 10 layers, and there is villus formation. There is dense inflammatory infiltrate will occur, that is lymphocytes, B cell, plasma cell and the macrophage from the blood vessel now enter into the joint space and they will aggregate into the lymphoid follicle. In neutrophil seen in the synovial fluid and the synovial surface. There is rice body formation, that is the fibrin that covering the synovium float in the joint space. Also there is pannus formation. It is a mass of synovium and the synovial stroma which contains the inflammatory cells, granulation tissue and the synovial fibroblast which will grow over the articular cartilage and destroy it. Now pannus bridges the opposing bone and fibrous ankylosis will occur. Then it will ossify to form the bony ankylosis. Ankylosis means there is destruction of the joint and followed by the fusion of the joint will occur. There is also osteoporosis because of the increased activations of the osteoclast and which will causes the erosion of the bone. In the skin, we can see that at the site of the pressure, like the ulnar aspects of the forearm, elbow, occiput, and the lumbosacral area, there is rheumatoid nodule formation. Grossly, we can see that it is a oval or round-shaped, non-tender, firm nodule in the subcutaneous tissue. And microscopically, in the central portion, there is fibrinoid necrosis, and in the which is surrounded by the epithelioid histiocytes, lymphocytes, and the plasma cell. In the blood vessels, there is the rheumatoid vasculitis will occur, which will affect the vital organs like the heart, lung, and the muscle. Then the clinical presentation. It is mostly seen in the age group of 40 to 70 years of the age. It is most common in the female, 3 to 5 times more prone than the male. Onset is slow and insidious. It is present with the malaise, fatigue, and generalized musculoskeletal pain. In the joint, symmetrical involvement of the joint will occur. Small joints are early affected than the larger joints. In the hand, most commonly metacarpophalangeal joints and the proximal interphalangeal joints are involved. Then the sequence of the joints involved are feet, then wrist, then ankle, then elbow, and then knee. The involved joints become swollen, warm, and painful and stiff. Because of their inflammation occur, so it is seen as the swollen and the warm. Radiography, we see that there is a infusion into the joint, so narrowing of the joint space will occur, and there is loss of the articular cartilage. So there is erosion and the osteopenia will occur. Clinically, there is deformities will occur, that is destruction of the tendon, ligaments, and the joint capsule. So there is deformed joint, do not have any stability and do not have any range of motions. As there is increase the intra-articular pressure, so there is outside projections of the synovium will occur. So large synovial cyst will form, and it's called the Becker's cyst, which is seen in the posterior of the knee joints. And there is also the swan neck formation. It is called the swan neck. Swan neck formation, that is the flexion and the hyperextension of the fingers, and there is ulnar deviation of the metacarpophalangeal joints, and there is radial deviation of the wrist. The common treatments of the rheumatoid arthritis is that NSAIDs, then biologics, DMRDs, and steroids.